in health sectors in this country, things have been very, very deteriorating.
What the problem we have in this country is system. We need to build a system that works. Our healthcare system, we need to build it.
Primary health centers play a vital role in providing essential healthcare services to communities, particularly in rural and underserved areas. In Nigeria, PHCs form the backbone of the healthcare system, serving as the first point of contact for those seeking medical care. However, the state of PHCs in Nigeria has been a subject of concern. While in some cases they are not existing, those that are in sorry state or lack adequate human and infrastructural facilities to function. Most of them lack the capacity to provide essential healthcare services. They also face the challenges of poor staffing, inadequate equipment, poor condition of infrastructure, and lack of essential drug supply.
First, there have been the case of negligence from the nurses, and oftentimes when you go, they don't meet doctors on seats. So we go to private hospitals, which are way expensive compared to the primary health center. I also learned that they will soon be evacuated because they are not making good use of the place. The place is underused.
That's PWI Primary Healthcare Center? Yes. How the place be?
The place no fine. Doctor no plenty there.
You know plenty?
No, now one doctor.
One doctor. Nurse unko?
Now one.
One nurse.
Part of our staff, part of them, underpayment, some omitted generally. So this is our another challenge.
Since when did they stop paying them?
Since 2015.
I was going to a government hospital and they don't have bed. They don't have bed, talk less of having drugs, talk less of having well-equipped laboratories. They don't have all these, all necessary things they do need to have. They don't have it there. So our wives and our mothers, they are suffering when they want to deliver. Even some, they don't even have it in mind of going to any hospital.
The challenges we have now is that all those facilities that government is supposed to bring down to the health center, it's no more there. Even if they bring it, all those head of the health centers, they will divert it to their private hospitals.
In some peculiar cases, spaces meant for primary healthcare centers are hijacked for personal gains. You get primary healthcare center for you?
We don't have the place because they bring it, they brought it, but the chief, there's nowhere to put a health center because chief don't sell everywhere.
Meanwhile, the Nigerian government depends on donors and NGOs to finance its health projects.
We need to really understand that the health system in the country or in the continent has been in a crying situation, right? So not just looking at Nigeria, but looking at countries around Africa. Over time, we've seen a lot of allocation come into the health sector, right? But what transpired is the question now, whether implementation happens or not.
Also, Nigeria falls short of the Abuja Declaration of 2001, in spite of the pledge by heads of states of African Union countries to set a target of earmarking at least 15% of their annual budgets to improve the health sector. In 2016, an attempt was made to revitalize 10,000 primary healthcare centers under former President Muhammadu Buhari. Out of the promised 10,000 PHCs, the previous government claimed to have done over 4,000. But much is left to be desired following the many investigations conducted by Premium Times. A new government has begun, and Nigerians who bear the brunt of a failed primary healthcare system suggest ways the current administration can fix this.
Health education needs to be put in place very well, and I have high hope in this government that they will do a lot better than the past one.
If you ask me, I would say instead of doing that, then the government should come to their aid by providing the resources they need, as equipping that place with the necessary equipment, and then basic training for the health personnel, the doctors, and then the nurses.
Like now, go put many chairs there.
Okay.
Some place go dress
inside go fine, no less inside.
The government should invest in our healthcare sector, monitor the investment, make sure proper systems are put in place for efficient functioning.
Let government beg, make it come to our aid, so that it is only government that has the power over that he will know where to get place for us anywhere.
Àwọn òṣìṣẹ́ tán dẹ̀ ń gbé wá síbí báyìí bóyá torí wípé kò síná ọ̀nà wa ò dáa wọn ò ń fẹ́ fi bẹ́ẹ̀ wá síbí báyìí. So gọ́ọ̀mẹ̀ntì ní láti ṣe àwọn ìrànlọ́wọ́ tó pọ̀ fún àdúgbò wa yìí bóyá ru ọ̀nà yẹn náà.
The main issue is for government to make sure that all those facilities, drugs and machines needed at the health center are being brought there, and make sure that no one, even the head of the health center, removed it.
So to say what pathway will I give the new administration, what I will say is we have 774 local governments in Nigeria and quite a number of wards. So can we have at least a minimum of one primary health care per ward in the country?
Investigations, special reports, analysis, and breaking news. Premium Times, a leading multimedia news platform, brings to you every minute stories that helps you make informed decisions and hold public officials, individuals, and organizations accountable. We have cartoons, videos, podcasts, and other interesting content for your delight. For timely update on politics, entertainment, sport, and business, visit our website on www.premiumtimesng.com and follow us on all our social media platforms. Don't miss out.